Assalamualaikum and a very good evening to everyone. My name is Muhammad Azizi bin Ahmad Tarmazi and my matrix number is JP1114/21. So today we would like to discuss an interesting topic. It's all about mental awareness. Indispensable, taking care of our mind is super important. That's what mental awareness is all about. This short intro dive into why it is crucial to pay attention to our mental well-being. Well, explore how our minds work, why it's okay to talk about how we feel, and how society play a role in all of this. Together, we discover the importance of being aware of our mental health, making a shared journey towards a healthier and happier lifestyle. Let's dive into the world of mental awareness and learn together. Today, I will bring to you 5 panels from our university that will share with us the important points about mental awareness. For our first panel is Ahmad Auzan bin Azhar. He will share with us is about meaning of mental illness and type of mental illness. And our second panel for today is Nur Liana binti Sukri, and she will share with us about the causes of mental illness, if I'm not mistaken. And our third panel is Nurul Afifah binti Muslim. She will share with us about the importance of mental health awareness. And our fourth panel for today is Nurul Saida binti Ruhazam. She will share with us about how to overcome mental illness and how to reduce society stigma against the mental illness. And the last but not least, our finalist panel, Mr. Muhammad Solehuddin bin Abu Bakar. He will be conclude about our topic for today.
Thanks to the moderators. Assalamualaikum and hi everyone. I'm Ahmad Auzan bin Azhar, matrix number JP111021. Today I will explain the types of mental illness. Mental illness are health conditions that change how we feel, think, and act, which can be upsetting and make it hard to do things with friends, family, or coworkers. Some common types of mental illnesses are personality disorders, obsessive compulsive disorder or CDC, post-traumatic stress disorder PTSD, dissociative disorders, facetious disorder, psychotic disorders, impulse control and addiction disorders, eating disorders, and personality disorders. People with anxiety disorders feel fear and dread when they see or hear certain things. People with mood disorders feel sad all the time or go back and forth between being very happy and sad. People with psychotic disorders often have hallucination and delusions as well as distorted awareness and thinking. When someone has an eating disorders, they have extreme feelings, thoughts, and behaviors about food and weight. When someone has an impulse control or addiction disorder, they can't stop doing harmful things. People with personality disorders like antisocial, obsessive compulsive, and paranoid have trouble at work, in school, or in their relationships. People with obsessive compulsive disorder or CDC have persistent fears or thoughts that make them do certain things over and over again. Dissociative disorders make it very hard to remember things. Being conscious, know who you are, and be aware of your surroundings. Post-traumatic stress disorder PTSD happens after a traumatic event. Thank you very much.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Liana binti Sukri. My metric number is JM13777621. Now I would like to share about the causes of mental illness, which is not simply one cause, but it is a complex mix of factors. Researchers are trying to unravel the factors that can include aspects of social learning and genetics that can be observed on humans' personality. As we know, human genes carry information that gets passed from one to the next generation. In recent studies, mental illness likely to has a genetic component, but it is complicated if a person may have inherited the mental illness from the past generations. So this probably caused by a combination of genetic and environmental components, such as how they grew up in the situation or in that kind of environment. In the long-term effect of trauma can make you more vulnerable to mental health problems directly caused PTSD, which means past traumatic stress disorder. This may cause troubles in your daily life, such as having more trust issues, which can make friendship and also relationship harder to maintain. So you also will have difficulty in managing your self-emotions because your mind is reacting to the memory of what have you experienced before, and this may affect your physical as well. Moreover, social isolation can have a negative impact on your mental health. So it is not only caused by being alone, but also being without some set of relationships. They will likely to feel unwanted, empty, and alone. Researchers stated that loneliness is associated with poor social skills, depression, and also introversion. Loneliness is more likely to set in when an individual has low family support and are dealing with functional limitations. For instance, introverts might be less likely to seek social connections, and this can cause to feelings of loneliness. Next, the use of drugs and alcohols can lead to serious issues to your brain. This can make you more likely to harm yourself and make you more unwell. Any person will be considered a chronic drug abuser if they have lost the power of self-control over the use of drugs. For example, drugs such as amphetamines, cocaine, and marijuana can cause paranoia, which is a type of anxious thought that causes people to exhibit an extreme mistrust of others. And drinking alcohols also can worsen things. Drinking alcohols also can worsen feelings of anxiety and extreme mistrust and agitations. As a result of heavy drinking, this can cause problems with working memory, verbal fluency, problem solving, and shortened attention span. So that's all from me. Thank you for lending me your ears, and thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Rafifa binti Muslim. My matrix number JP111261. Today I want to talk about the importance of mental health awareness. First, reducing stigma. Mental health awareness helps reduce the stigma surrounding mental health issues. This stigma often prevents patients from seeking help or discussing their struggles openly. This is because there are a few people in community who considers mental patients to be crazy and there is no hope of recovery. Therefore, this stigma should be eradicated before it's getting worse. Second, promoting early intervention. Increased awareness promotes early detection and intervention for mental health issues. By doing early identification, patients know their level and types of mental health illness, so they can get early treatments. This action prevents the condition from worsening and improve the outcomes. As the saying goes, prevention is better than cure. Last but not least, enhancing understanding. Education about mental health is very important. It fosters a better understanding of the various mental health conditions, their causes, and the available treatments. This understanding is crucial for creating empathy and support for patients. In conclusion, mental health awareness is very important It is a key step towards building a culture that values mental health as an integral component of overall health. That's all from me. Thank you.
Hi, Assalamualaikum and greetings to all. I am Nurul Saida binti Rohazam, metric number JP1117821. Today, I will explain how to overcome mental illness and how to reduce society's stigma against mental patients. Overcoming mental illness and reducing society's stigma against the mentally ill involves a combination of personal strategies, community effort, and society change. Here are some general guidelines that can contribute to both the individual well-being and society transformation. There are many ways to overcoming mental illness. Among them are: first, seek professional help. Consult with mental health professionals such as therapists, counselor, or psychiatrists. They can provide guidance, support, and evidence-based treatments. Second, build a support system. Surround yourself with a supportive network of friends and family. Open up to them about your struggle and let them be part of your journey toward recovery. Third, educate yourself. Learn about your specific mental health condition. Understanding the symptom, triggers, and available treatment can empower you to manage your mental health more effectively. Fourth, practice self-care. Prioritize self-care activities, including regular exercise, adequate sleep, and healthy nutrition. 5. Medication management. If prescribed medication, adhere to your treatment plan and communicate regularly with your healthcare provider about any concern and adjustment needed. Knowledge is a powerful tool in reducing stigma. Second, encourage open conversations. Foster open dialogue about mental health in communities, workplace, and educational institutions. Encourage people to share their experience without fear of judgment. Third, share personal stories. Personal narrative can humanize mental health struggle. Encourage individuals to share their stories to reduce stereotypes and cultivate empathy. For the last one is normalize mental health discussion. Integrate discussion about mental health into everyday conversation. Normalizing this discussion help reduce the perception that mental health is a taboo topic. Remember, progress in overcoming mental illness and reducing stigma is a collective effort that involves individuals, communities, and societies working together toward a more compassionate and understanding future. Thank you.
Assalamualaikum. My name Muhammad Salahuddin bin Abu Bakar. Today I want to conclude about the mental health awareness. In conclusion, people who have mental illness need help from others. That they deserve to have the same respect, consideration, and right to have treatment as any other illness. They also need some counselor as services to support them and give advice how to overcome and also solve their mental illness. Other than that, they must have a treatment or diagnosis of their mental illness, but it can be an important part of the collaboration process. It is because there are many ways and resources available to help people with mental illness or disorders. Burden of mental illness seen by the world as one problem that can be solved before it becomes more serious. It is because many people do not know about the realities of mental illness, and so they continue to believe misconception. Once you know the reality and knowledge about mental illness and what's the cause and how to solve it, you can help bust misconceptions. when they speak realities. So to promote mental health, there is a need to create such living conditions and environment that can support mental health and allow people to adopt a healthy lifestyle. Thank you.